My name is Virginia. I'm the managing partner of one of the GP practices at risk of closing. We're one of the largest practices in Tower Hamlets, and we're trying to raise awareness around the potential of the GP surgeries closing and trying really to get our voice heard by the people that can make a difference.
So can you just tell me for a second sort of the story about the practices closing, what practices are at risk, etc.?
In 2004, we moved to something called a new general medical services contract, where some practices, especially practices that had high level of deprivation and thus high levels of staffing, were given a sum of money, which is called minimum practice income guarantee, to fund the shortfall created by the new contract in recognition of their deprivation. This funding is now being removed over 7 years, starting 1st of April of this year, and several practices, of which 22 in East London and 36 in London, will be so severely impacted by the removal of this deprivation payment that we actually risk closing. My practice, which is the Jubilee Street practice, is considering handing in notice in October of this year because we basically would start paying to see patients. And this is sort of one of many steps that has been taken in recent years by the government to reduce practice income.
Okay, and this is like almost an overwhelmingly sort of East London centric issue.
It is, yes. Very much East London. I would say almost 25% of the practices affected nationally is based in East London. So 12 in Hackney, 5 in Tower Hamlets and 5 in Newham.
And in terms of these closing, what would you say would be the effect on healthcare in the region in general?
The effect would actually be I would say quite devastating for several reasons. The first would be the loss of continuity for these patients. So I can speak for Tower Hamlets where I work. We have some of the best outcomes on chronic diseases such as asthma, COPD, diabetes, cardiovascular disease in the country, some higher than Kaiser Permanente's in the United States. And this has been, it's been a decade of work to lead us to where we stand now nationally with our clinical outcomes. And I think that the loss of GPs, this is for 700,000 patients, would be detrimental to their health, obviously. We have much higher mortality rates in Tower Hamlets. People die 10 years before the national average. They get sick 12 years before the national average, and with a collection of diseases, so they carry comorbidities which are not typical of your English population. These very needy, very deprived people would find themselves without their own GP with very little notice. The second risk obviously would be privatisation, because practices such as mine would risk being put to tender if we weren't able to manage within the new financial portfolio.
So it is definitely the most deprived areas, and people who are most deprived are most at risk from these new measures.
They are, because they get sick earlier, they die earlier, they are sicker than the average, which means that their use of GP surgeries is much higher than average. So they rely on GPs in a very different way, I would say, from other places in the country.
And this forum that's taking place today, can you just tell me a bit about that?
Tonight's forum is a forum that brings together GPs, most of the GPs in Tower Hamlets, many GPs of Hackney and of Newham, to try and really, we're trying to raise a campaign which has been really widely publicised. It's been on BBC News, it's been on the radio, it's been, we've been to Parliament, to the House of Commons, we've been to Westminster several times. We're really trying to raise awareness and speak loudly so that it's clear exactly the degree of the impact that this would have. There are solutions to this problem. This isn't a problem without solutions, and we have a number of solutions in mind. What we're really trying to do is speak from one voice to get the message across that we'd like to sit down at a table and look at these solutions with Jeremy Hunt before it's too late.